Continuing now in chapter 13, just continuing to learn more about these infections and ways that microbes cause disease. So first of all, some terminology that we'll go through. So the patterns of infection. So once they've been able to establish, we can either have a localized infection, whereas the name implies it's only in one place, or a systemic infection where it's able to get into the blood or the lymph and essentially go everywhere throughout the body. We can have focal infections where they start at one place and kind of travel to another. There can be mixed infections that are caused by various microbes. And then just a couple other terms. So we have a primary infection. So that's going to be the start, like an initial infection. So here we have a urinary infection. However, as that starts altering the normal flora, we can then get a secondary infection. So a secondary infection only occurs as those opportunistic pathogens are able to take kind of over where they normally would be hindered. So that secondary infection only occurs because another infection is present. So again, just hitting through these terms again. So localized infection, the microbe enters, but it remains in a specific tissue. So like a boil, skin infections, or warts, they're in one specific area. Systemic, those spreads to several sites, so usually in the bloodstream. So again, it has a means of traveling. It can also go by the nerves or the cerebral spinal fluid. So it's not only the blood. So again, systemic just means it can travel to various locations. The focal, this exists whenever that infectious agent breaks loose from a local infection and is carried to other tissues. So it's not systemic, it's not being able to move everywhere, but it can move to a new location. So tuberculosis or streptococcal pharyngitis, which starts in the throat, but then can cause scarlet fever in the heart, that's an example of a focal infection. Then mixed infection, this is where it's caused by several agents. So it's not just one specific one, but it's multiple agents at the infection site. So it's called polymicrobial, many microbes. Diseases, so gas gangrene, different wound infections, because there are lots of different things there. Cavities, again, lots of biota, bite infections, again, because lots of microbes are now being introduced. And then the difference between the primary and secondary infection, again, primary is that initial infection, again, our urinary infection, where somebody got that infection, but then that can lead to an additional second or secondary infection. This is only when that first infection causes complications, and now we have a different microbe causing a second infection. So a couple other terms. We can have an acute infection, so this comes on rapidly and is usually short-lived. So think about typically like strep throat, we're exposed to it and then we get rid of it. Whereas chronic infections persist for a long time, so they take a long time for them to be resolved, if ever. Now, some of the warning signs of a disease, the difference between a sign and a symptom. So a sign is something objective. It can be noted by the observer, so it's precise. So something that somebody else can see. So a rash, for example, or a fever. Whereas a symptom is subjective. So it's something just sensed by the patient. So a headache, nausea, we can't measure that. Nobody else can feel it. It's something that the person is experiencing. And then syndrome is a disease identified or defined by different signs and symptoms. So there's not a specific kind of test for it, but again, a syndrome is something diagnosed just from the signs and symptoms. And here are just a few examples showing, again, the differences between those objective signs. Again, a fever, we can hear the chest, other people can see that swollen lymph nodes, whereas symptoms are just kind of felt by the patient. So chills, again, even pain, fatigue, or kind of being tired. Again, those are things experienced by the patient but can't be seen by somebody else. Some Another thing that goes along with this here, so inflammation. So this is one of the earliest symptoms of the disease. So edema is that accumulation of fluid, so swelling is typically what we call that. So the tissue that's being infected, it leads to fluid, granulomas and abscesses. So this is walled off collections of those inflammatory cells that are there. And then lymphadenitis, this is the specific term for swollen lymph nodes. A few other terminology, a few other terms here. Leukocytosis. This is increase of white blood cells. So leukocytes are the white blood cells. Leukopenia. This is a decrease in the level of white blood cells. So cytosis, we have too many. Leukopenia, too little. Septicemia. This is kind of a general state when microbes are multiplying in the blood and in large numbers. So septic shock, for example, causes an immune response, but it's due to microbes in the blood. Bacteremia, this is when there are small numbers of bacteria in the blood. So they may not be multiplying, but they're present. So again, kind of the initial bacteremia. Viremia, this is whenever there are some viruses in the blood, but again, not quite actively multiplying, but they are present. But then septicemia is whenever they're actually multiplying and in large numbers. So a lot of times these infections go unnoticed and they're called asymptomatic, don't cause symptoms. Also subclinical, they don't reach the point of like a diagnosis or being something that can be observed, or inapparent. So those are all terms that can kind of use this. So this is where the host is infected. So there's a microbe that is multiplying on it, but it doesn't lead to a disease. So there are no symptoms. Again, there's no disease because there's no pathological change to the tissues or the organs. So no attention is sought. And a lot of these infections have some type of sign. So there may be something present, it's just not enough to kind of cause alarm. All right, so our last step here of causing an infection is getting out. So now that they've gotten in, how do they get out? So our portals of exit, so this is just how they get out. And it's similar to how they get in, but secretion, so even sweating or through an opening, they're excreted through urine or feces. A discharge, think about like mucus and a lot of phlegm whenever we have a cold, or sloughing off of tissues. So through the respiratory tract, again, mucus, sputum, kind of drainage. The skin, again, that sloughing off of that outer layer constantly sheds microbes. Through the feces, so increased like motility, so diarrhea commonly occurs. Urogenital, so vaginal discharge, like with a yeast infection, or it can be removed through the semen or urine. And then also through the blood, so through a puncture, releasing those microbes. Now, a few other terms here that go along. So we can have long-term infections and effects. So they can go essentially latency is a dormant state. We talked a little bit about these with some viruses. Again, where we have viruses where the DNA becomes integrated and they become dormant. Microbes or bacteria can also do the same thing. So during this dormant state, the microbe periodically becomes active and the disease reoccurs. So like syphilis, TB, and malaria are examples. So they kind of go away, but then they can come back. And then another term here, sequela. This is long-term kind of permanent damage to an organ or tissue. So for example, in meningitis, whenever there's an infection, but because it persists and the bacteria stay there, it can actually cause deafness. Strep throat can cause heart disease. Lyme's disease can cause arthritis. And again, that's where the continued presence of a microbe leads to long-term effects. Now, the course of an infection, so we have, and we'll see a graph here in a minute, but first we have the incubation period. So that's the time from the initial contact to where we have our first symptom. So nausea, vomiting, a fever, something like that, something where somebody notices it. So again, how long it takes from exposure to actually having an effect. Then prodromal, this is the earliest notable symptoms start to appear. Then there can be an acute phase. This is again when it's multiplying in high levels. This is when it's really virulent and it's well established. And then we go through this convalescent stage. So now the patient responds and the symptoms decline. So here's our graph. So again, incubation period. So first exposure to actually having a symptom, and that varies hugely, depends on the pathogenicity. Sometimes it's within 24 hours after exposure. Sometimes it's a week later that you were exposed to something before symptoms occur. But those initial symptoms there are the prodromal. Then we get the acute phase. Now they're able to multiply, they're damaging the host, and then it kind of reaches a plateau. Our host defense starts kicking in. We can make antibodies, we start destroying it, and then we enter this convalescent period where those symptoms start going away. Now, with those persistent infections, though, sometimes they're not completely eradicated, like we see here, but they can go to that kind of latent period or continuation where they're not really causing a lot of problems, but they're still present. And this is where like arthritis can occur from Lyme's disease. So we're not getting a lot of symptoms from the presence, but they're still causing long-term damage. Next, talking about reservoirs, and this is where pathogens can kind of exist or remain for long times. So it's the primary habitat where the pathogen originates. So where does it actually come from? So there can be human or animal carriers, so where they're just being transmitted between humans and animals, or it can originate from soil. They can be waterborne. They can come from various plants as well. So the source then is distinct though from a reservoir, so that's different. So reservoir is more the habitat. The source is the individual from where the infection was acquired. Okay, so we may have an agent, a microbe that really mainly hangs out in soil. And so one person gets an infection from that soil microbe, but then gives it to another person. So that person was the source. They gave it to somebody else, but it ultimately originated in the soil. So the soil is the reservoir. Where someone actually gets infected is the source. Or another example, again, the reservoir could be soil. There could be a knife that was contaminated with something in the soil, and then someone was cut with the knife. So the knife is the source. It actually had the microbe on it. But again, the reservoir for that organism is soil. It's where it normally hangs out. And then whenever we're talking about people, we talk about carriers. So this is an individual who is inconspicuous. So they don't know they have the disease, but they're sheltering a pathogen. But it can spread without knowing it because it's on them. They're not, again, they're asymptomatic. They don't know they have the disease, but they could definitely give it to somebody else. All right, so sometimes the reservoirs, again, this is the natural habitat, are actually living organisms. It's not just soil. So some of those can be animals other than humans and arthropods. So then they can be directly transmitted to humans, or they can be transmitted by vectors. So like mosquitoes or ticks are good examples of vectors. Or they can even be transmitted through a vehicle, which would be something like water or food. So actively ill humans have indirect transmission. So for example, a person with a cold contaminates a pen, and then a healthy person picks up the pen and receives the infection. So the human's still transmitting it. It's just indirect because it wasn't person to person. It was person, pen, person. Or there can be direct transmission, which would be, as it implies, one sick person sneezing on a non-sick person and transmitting it that way. So lots of different ways to transmit, directly, indirectly, through inanimate objects like a pen, or with vectors or vehicles like ticks or water. So other living reservoirs are carriers. So again, we mentioned some individuals are asymptomatic, so they have the pathogen. So they've fully recovered, they're not sick. So like, for example, recovered from hepatitis. So they don't have any symptoms, but they're still shedding that virus in the feces, and then that can be passed on to somebody else. Or again, the arthropods, unfortunately, lots of those like fleas, mosquitoes, ticks, and flies. So whenever the arthropod is the host, again, reservoir, natural kind of habitat, again, it becomes a mode of transmission. It can contaminate whenever they sting or bite you. And then the term vector. So in epidemiology, a live animal that transmits an infectious agent is called a vector. So the majority of them are arthropods, like the fleas and the ticks. Then we have biological vectors versus mechanical. Names kind of, or the difference is kind of intuitive, but biological, they're actively participating in the life cycle. So they're a site that the pathogen can multiply or complete its life cycle. So it communicates that agent to humans by biting, aerosol formation, or touching. Whereas a mechanical vector, this isn't necessary for the life cycle. So it's merely just transporting it. So again, for example, like they're sometimes called an intermediate host. So they just happen to be infected and they pass it on. The organism can't reproduce in that vector, but again, it can still pass it on. And, a tick could be a biological vector or a mechanical vector. It may just be passing it from one organism to another. So it's a mechanical, or the organism could be reproducing inside of the tick and making it a biological. So again, just the difference here. So biological vectors are actually infected. The microbe is actively multiplying inside of the chicken or inside of this mosquito or a bat, whereas a mechanical vector, again, like a fly, may pick up a virus from one person and transmit it to another. They're not actually reproducing on the fly or the insect, but they are still transmitting it. So zoonosis is an infection that's indigenous to animals, but also transmissible to humans. So essentially animals giving humans disease. So human is a dead-end host. They're not supposed to be part of the life cycle. However, it ultimately can cause disease. So the microbe usually doesn't even want to be there. It's not part of its natural persistence. So the spread is promoted by close association. So again, dogs or pets, or just being in the wilderness. And then people in animal-oriented or outdoor professions, of course, are at the greatest risk. And some examples, rabies probably the most common, but also like ringworm, toxoplasmosis that is come from cat feces. So again, the animal is infecting the human, but it's not really part of the natural life cycle for that microbe. And then we also have non-living reservoirs where the microbes can adapt to nearly every habitat. So they can be living in soil, water, air, or just different environments. So most are sapropic, just meaning that they can cause little harm to humans. So they're again not part of that. So they need certain conditions that humans don't provide. Some are opportunistic, again, meaning they normally don't cause a disease, but they can if the immune system is reduced. But then there are a few that are regular pathogens. But typically, whenever non-living reservoirs are used, humans are not going to be good habitats for that pathogen. But tuberculosis, for example, is one in which it is a regular pathogen. It's directly transmitted to humans, but it's from contaminated soil, water, or air. So then acquisition and transmitting. So again, some more terms. Communicable disease. We mentioned this way back in chapter 1, but this is when the infected host can transmit from one to another to establish that. So it's Again, contagious is another term we use for that. So they can pass it from one person to the other. Again, that term contagious just means it's highly communicable. It's easily passed from one individual to another, especially if they actually have direct contact. Again, touching, kissing, or sexually transmitted. But again, it can pass between two people or two hosts. That's communicable. Contagious just means it's highly communicable. And then non-communicable, as the name implies, it does not arise through transmission from host to host. So it's obtained in other ways. So when we're talking about transmitting, we can either have horizontal transmission or vertical. So in horizontal, the disease is spread through a population from one infected person to another. So again, thinking like linear. So this person gets it, gives it to another, kind of like a domino effect. So it's due to direct contact or transmission like kissing or sex. Can also be indirect transmission. Again, somebody coughs and sneezes on a pin, somebody picks up the pin and transmits it that way. So fomites are inanimate objects, a pin, for example, a toilet seat. Again, those vehicles are through different injections or by a vector transmission, again, oil or food, water, etc. Whereas vertical transmission, this is where it's from the parent to the offspring. So it's passed through like the placenta or the milk, the ovum or the sperm. So again, they're getting it from their parents. That's vertical transmission. So most of the time we're talking about horizontal. And then with that indirect transmission, again, some of our terms, vehicle, this is when it's an inanimate material that's commonly used by humans that's transmitting the infectious agent. Fomites are inanimate objects that harbor and transmit the pathogens, so they're not a continuous source of the infection. So again, like a pen would be an example there of a fomite. And then the oral fecal route is another indirect way, as the name implies. So the fecal carrier is inadequate personal hygiene, contaminates food during the handling, so not properly washing their hands, so going to the bathroom, not washing their hands, and then they're passing that on. Fecal contamination on their hands is then passed on to the unsuspecting person. So also we have droplets and aerosols. So think about respiratory ways. So of course we've seen pictures like this where when someone sneezes, all of this that's coming out that we don't see. So again, providing those microbes into the air in this way. So a droplet nuclei, so this is dried microscopic residue, creates these pellets of mucus and saliva. So that's what we're talking about in this picture. And then also aerosols, which are suspensions of fine dust and moisture particles in the air that have those live pathogens. Lastly, here we're going to talk about Koch's postulates, which is how we determine what is actually causing a disease. So again, the aim is to study the infection to determine the causative agent or the etiological agent. So just a little bit about this. So Robert Koch, he developed the standards for determining the causation that stood up to scientific scrutiny. He determined the causative agents of anthrax, and those postulates are a series of proofs that establish what is actually causing a disease. And so those postulates, so first, you have to find evidence that a particular microbe is in every case of the disease. So again, if it's causing the disease, there shouldn't be any time somebody had the disease and didn't have that microbe present. The microbe needs to be isolated from the infected patient and cultivated in pure culture so that it can be characterized. Then if that agent is inoculated or added to a person in a laboratory setting, like the mouse over here, then it should cause the same disease, and it should then be re-isolated from that subject. So if it's injected into a subject, the subject has the disease, then it should be able to be re-isolated from that patient. And that's a way of establishing what is actually causing the disease.